Without further ado, I will introduce Bridget Borg, who is the lead for the respiratory stream of the Hazelwood Health Study. So over to you, Bridget.
Thank you, Michael, and thank you for the opportunity to present briefly about what the adult respiratory stream has been up to in the last 12 months. So in terms of what we've been doing over the last 12 months, we've continued to analyse data from the first round of clinical assessments that took place in 2017-2018. And we're very lucky to be about to finish up data collection for round 2. So we commenced in Morwell in May 2021 and then moved down to Sale just last month to do some data collection there. And as Michael's alluded to, the data collection was unfortunately interrupted by 3 statewide and 1 local lockdowns for COVID-19. I'd really like to acknowledge and say thank you to Michaela and Tom, who are scientists from Alfred Health, who have undertaken the data collection for the clinical visits for the respiratory stream. Without them, we would be lost. In terms of data collection for round 2, in Morwell, we have had about 223 of our 346 participants who participated in round 1 come back for testing in round 2. And for Sale, by the time we finish testing there next week, we will have had about 114 participants from round 1 attend for round 2 clinical visits. As Michael said earlier, we're very grateful for those participants who have attended round 2 of clinical assessments. Your attendance allows us to understand the impact of the smoke from the mine fires on lung health, which ultimately helps to inform the government around healthcare resourcing for Gippsland in the future. In 2021, we have had 3 publications to scientific journals, and I'm just going to speak about the results from those findings in brief. So the first study, we actually mentioned at last year's community briefing, but it was a long time ago, so I'll just briefly review it again. So this study looked for associations between mine fire smoke exposure and a newer lung function test called the forced oscillation technique. The forced oscillation technique measures the stretchiness or the stiffness of the lungs, and it does this by sending sound waves into the airways while breathing on a mouthpiece. And this creates a wobbly type feeling, and we measure what comes back. In our analysis, we found that as exposure to mine fire smoke increased, there was a reduction in the lung stretchiness, and this suggests that those with higher exposure to mine fire smoke had poorer lung health. And importantly, a similar finding was found in the early life follow-up stream 2. The data that we've collected in round 2 testing will hopefully allow us to better understand this finding. This study is unrelated really to the study questions of the Hazelwood Health Study, but is interesting nonetheless. This study looked for associations between e-cigarette use or vaping and poorer lung health. Out of the 519 participants for round 1 testing, 46 of them had either vaped or used e-cigarettes. Those who used e-cigarettes tended to be younger, be using tobacco products also, have a mental health diagnosis compared to the non-e-cigarette users. They also reported more asthma, more symptoms of chest tightness, and reduced lung stretchiness than non-e-cigarette users. I also spoke about the findings from this publication as well, that we'll mention for completeness. So this publication investigated associations between mine fire smoke exposure and COPD, or chronic obstructive pulmonary disease. COPD is a disease that results in persistent obstruction to airflow within the lungs. In other words, the airways are narrowed and it reduces the ability of a person to be able to blow out quickly. To assess for COPD, we performed a test called spirometry, which measures how fast and how much air can be exhaled from when you're full to when you're very empty, and from empty back to full again. We also used questionnaires to determine symptoms such as cough, chest tightness, and medication use. We found that as exposure to mine fire smoke increased, There was an association with increased chest tightness and chronic cough. So that's 3.5 years out after exposure to the mine fire smoke. And in more non-smokers, we also found that increased mine fire exposure was associated with an increased finding of COPD type patterns on lung function. This relationship was not seen in smokers though. But in smokers, increased mine fire smoke was associated with increased evidence of chronic cough. So just to finish up, what are our future plans? In the next week or so, we're going to complete data collection for round 2 in SAIL, and then we'll commence the process of analysis of round 2 data. And coming up over the next 12 months, we're going to use the findings from round 2 to decide which round 3 testing should be done in 2023 and start the planning for round 3 data collection in middle of 2023. Thank you, Michael.